Hello, everyone, and welcome back to MetaMind, where we teach you to take control of your health. Alopecia, common term hair loss, is a condition that affects millions each year. Hair loss does not discriminate and can affect both women and men of any age. But what's the science behind it, and how can minoxidil help? Hair loss is a chronic dermatologic disorder which can involve hair loss from any part of the body. Most often, it involves the scalp, and this can lead to secondary issues such as psychological suffering due to cosmetic reasons. The hair growth cycle consists of 3 phases: the anagen phase, the catagen phase, and the telogen phase. During the anagen phase, your hair grows actively as cells in the root of the hair divide rapidly, adding to the hair shaft. The hair can grow around 1 centimeter per month, and this phase can last anywhere from 2 to 7 years, depending on your genetics and other factors. The longer this phase lasts, the longer your hair can grow. About 85% to 90% of the hairs on your scalp are in the anagen phase at any given time. The catagen phase is a transitional phase that marks the end of the active growth of a hair. During this short phase, lasting about 2 weeks, the hair follicle shrinks and detaches from the dermal papilla, cutting off the blood supply to the hair. This phase is like a reset for the hair follicle, preparing it for the next growth phase. The telogen phase, also known as the resting phase, is when the old hair is released and falls out. The follicle then remains inactive for about 3 months before the cycle repeats. During this phase, about 10% to 15% of your hair follicles are in the telogen phase, while the rest are in the anagen phase. Eventually, a new hair begins to form, and the cycle starts again with the anagen phase. Normally, about 100 scalp hairs reach the end of the resting phase each day and fall out. Clinical hair loss is defined as the excessive shedding of more than 100 hairs per day during the telogen phase. In alopecia, hair loss can occur for several reasons. One possibility is that more hair is lost during the telogen resting phase than the number of new follicles created during the anagen growth phase. Another cause is when hair prematurely enters the telogen phase due to various stressors, which can include physical stressors such as illness, surgery, or childbirth, as well as emotional stressors like anxiety, depression, or significant life events. Additionally, trauma to the hair follicle, which can result from injuries, exposure to harsh chemicals, excessive heat from styling tools, or inflammation of the scalp due to infections or autoimmune disorders, can also lead to hair loss in alopecia. Minoxidil, the common brand Rogaine, is a medication used to treat hair loss, and while its exact way of working isn't fully understood, it's believed to help in a few ways. Firstly, it might lengthen the time your hair spends in the growth phase, known as the anagen phase, which can lead to thicker and longer hair. Secondly, minoxidil could improve blood flow to your hair follicles, providing more nutrients and oxygen for hair growth. It may also stimulate the hair follicles to produce new hair and increase the diameter of existing hairs. Lastly, minoxidil might shorten the resting phase of your hair, known as the telogen phase, which means more hair follicles are actively growing hair, reducing overall hair loss. Minoxidil can be used by both men and women, however, the concentration and form of use are important. Men can choose between 2% and 5% solutions, while women should use the 2% solution. Both men and women can use the 2% solution meant for men. There's no difference in the formula. However, the men's version is often cheaper due to marketing reasons. A solution in this context refers to a liquid formulation of the medication that is applied directly to the scalp using a dropper or spray bottle. For the solution, both men and women should apply it twice a day using 1 milliliter each time or half a capful. Women also have the option of using a 5% foam, which is used once daily with half a capful. Men using the foam should apply half a capful twice daily. Women should make sure to use the 5% foam, not the 5% solution. Continuous therapy for 4 months is required to see significant hair growth with. This extended duration is necessary because minoxidil works by stimulating hair follicles, which can take time to produce visible results. Additionally, hair growth occurs in cycles, and it may take several cycles for new, thicker hairs to replace the old ones. Therefore, consistent use over several months is often recommended to achieve the best results. There is a common misconception that minoxidil causes hair loss when used. However, this is not the case. When minoxidil therapy is discontinued, the hair that was retained or regrown during treatment may gradually be lost. This is because minoxidil acts as a stimulant for hair follicles, much like a glue that helps hold hair in place. When the glue is removed, the hair that was being supported by minoxidil may fall out. This phenomenon is similar to how a temporary adhesive might hold something in place. Once the adhesive is removed, the item may no longer stay attached. Therefore, it's important to understand that minoxidil is a treatment that requires ongoing use to maintain its benefits. Common side effects of minoxidil include scalp irritation or itching, dryness or flaking of the scalp, and unwanted hair growth on other parts of the body. Less commonly, some individuals may experience an increased heart rate or palpitations with topical use. These side effects are usually mild and often resolve on their own. If you experience severe or persistent side effects, it's important to consult your healthcare provider. If you found this video informative, please consider subscribing to our channel for more updates on medications and health topics. Don't forget to give this video a thumbs up if you found it helpful. Thank you for watching, and remember, your health is your greatest wealth. Stay safe and take care.